Hi everyone, it's Hannah, and today I'm going to be teaching you about nutrition informatics. So, objectives. By the end of this video, my objectives for you are that you will understand what nutrition informatics is, you'll know examples of nutrition informatics in several different sectors of dietetics, and you'll also know where to go to learn more about nutrition informatics. So what is nutrition informatics? According to the Academy of Nutrition and Dietetics, nutrition informatics is the intersection of information, nutrition, and technology. Nutrition and dietetics professionals work in an immensely data-rich world. As many paper-based tools transition to technology, there are more efficient ways to collect, display, and study data from tools such as food and nutrient analysis tables, electronic health records, and mobile apps. Nutrition informatics allows nutrition and dietetics professionals to more effectively use their knowledge and skills through the support of technology. Nutrition informatics impacts all areas of dietetic practice. For example, for clinical, we have electronic health records and telehealth. On the consumer-based side, we have apps and wearables as well as social media. For food and nutrition management, we have staffing and workload statistics and recipe analysis. For public health, we have surveys such as NHANES. For research, we have data collection and analysis. For retail, we have consumer purchasing trends, sales history, and inventory. And then for public policy, we have evidence-based policy making and measuring policy outcomes. So now I'm going to play a video for you. It's about health informatics in general, but I think the difficult part of defining nutrition informatics is the informatics bit. So hopefully this video helps clear that up a little bit.
You've heard a lot of people talking about health informatics, but what is it exactly? In short, it's the way we manage the mountains of information generated by health resources in the digital sphere. Okay, so what does that mean exactly? Let's take a look at what some students are doing in the Master of Health Informatics program at the University of Michigan. Health informatics can touch all aspects of life. They can be helpful at home, where a smartphone app keeps track of everything in your fridge. If your groceries are about to expire, your phone can suggest recipes that use those ingredients so they don't go to waste. They can be valuable in the community, with meetup sites that allow people suffering from similar chronic diseases to find each other and get support in a situation that often leaves people feeling isolated and misunderstood. They can be powerful in combating disease. By gathering tracking data on the movement of mosquitoes carrying the Zika virus, communities can focus on prevention instead of being unprepared for an illness outbreak. Health informatics applies information to help people lead healthier lives. To learn more.
All right. So now, what does health technology mean? According to the World Health Organization, a health technology is the application of organized knowledge and skills in the form of devices, medicines, vaccines, procedures, and systems developed to solve a health problem and improve quality of lives. So how does this impact nutrition care? Well, wearables is a big one, including the insulin pump, but also including smartwatches and wearable ECG monitors and blood pressure monitors, which are even being included in some smartwatches, including the Apple Watch in their newer series. Another one is apps. Tracking apps such as MyFitnessPal are very, very common, as I'm sure you all know. And then apps like Google Diabetes, which we learned about from Michael Fox during our foundation weeks. Finally, I have food sensitivity tests on there. The image to the right is from Everlywell. It's a food sensitivity test which claims to pinpoint an individual's food sensitivities via finger prick and provides guidance on what foods to avoid. And these are available online in pharmacies. They usually run, or this one at least runs at about $160. These systems measure IgG reactivity to foods, which isn't really a reliable marker in terms of sensitivity to different foods. And these products are marketed to people with acne, fatigue, bloating, and other super common symptoms. So, although there are both benefits and downsides to health technology, we should be prepared to encounter both of those things. And the internet is another great example. So, I'm sure we'll all have patients and clients come to us with something they read online, and then we'll have to navigate how to provide them with the evidence-based information we learned during our degree and our internship. But then again, the internet is an amazing resource if patients and clients know how to seek out credible sources. So how does nutrition informatics impact the practice of an RD? So the first one is health information exchange, which is represented in the infographic to the right there. Electronic Health Information Exchange, or HIE, allows doctors, nurses, dietitians, and other healthcare providers and patients to appropriately access and securely share a patient's vital medical information electronically, improving the speed, quality, safety, and cost of patient care. So examples of this include the transfer of a patient's anthropometric measurements from their dietitian to their secure patient portal, and the transfer of information from one medical care facility to another. This can reduce clipboard syndrome, which is burnout in a patient who frequently seeks medical care and constantly has to fill out forms asking them the same questions, such as what allergies they have and what medications they are taking. The next one is Computerized Provider Order Entry System. CPOE refers to the process of providers entering and sending treatment instructions via a computer application rather than paper, fax, or over the phone. CPOE has been shown to reduce the number of medication errors in hospitalized patients by using point-of-care clinical decision support, which I'll cover in the next slide, and enhanced patient safety through built-in medication interaction checks. Many CPOE systems check for drug-drug interactions, drug-disease interactions, for example, alerts when ordering a blood thinner if a patient has an active diagnosis of upper GI bleed, and then drug-nutrient interactions. Another one that is sometimes on there is drug age. So Beer's List is included to assist providers when ordering medications for the geriatric patients to make sure that they're getting the best help that they need and they're not being prescribed anything that could potentially harm them. Continuing on, we have clinical decision support systems, which I mentioned previously. This infographic to the right is named The 3 Pillars for Realizing the Promise of CDS. A clinical decision support system is a health information technology system that is designed to provide physicians and other health professionals with clinical decision support, that is, assistance with clinical decision-making tasks. So this includes anything from documentation templates to computerized alerts. CDS systems are great because they make large amounts of data or information more accessible to the provider. Next, we have EHRs, or electronic health records, which are digital versions of a patient's paper chart. Benefits of using EHRs as opposed to paper charting include compatibility with telehealth and health information exchange, enhanced security, and helping to promote legible documentation. EHRs and patient portals can also be very helpful to the patient or client because they are able to access their health information anywhere, anytime, as opposed to having to go to their doctor for a printed health report. Finally, we have telehealth. Telehealth is the distribution of health-related services and information via electronic information and telecommunication technologies. It allows long-distance patient and clinician contact, care, advice, reminders, education, intervention, monitoring, and remote admissions. As we talked about during our foundation weeks, telehealth was already becoming more widely used even before COVID. But since COVID, telehealth has grown even more and definitely won't be going away anytime soon. So now let's talk about the impact of competency. Well, we want to be competent in nutrition informatics because it's on the exam, first of all. So they specifically point out 4 different things to know. 1, telehealth and remote health monitoring systems. 2, electronic health records. 3, food and nutrient analysis software and databases. And 4, food service management software. Secondly, for self-marketability, as new dietitians coming up pretty soon here, hopefully, it's to our benefit to be up to date with current technology and to be quick learners when it comes to new software. And then there's also emerging technology, including 3D printing and biosensing tattoos. So 3D printing has been used in several ways. One way is to incorporate insect flour into foods to make them more appealing and more appetizing. This is great from a health and sustainability stance because insects are high in protein and fiber and are very cheap and sustainable to produce. 3D printing can also transform meat offcuts and distorted produce, which may otherwise be wasted. Meat bioprinting is another application for 3D printing. A startup in Barcelona is working on 3D printed steak and pork using plant-based foods in order to be more sustainable. And that's what this video is to the right here. So let's go ahead and watch that one. So I thought that was pretty interesting. It's predicted that by 2050, there will be 9.74 billion people on Earth, which is more than can be sustained using our current food system. All 3 of the applications I mentioned about 3D printing are helping to mitigate the impact the rapid population growth will have. I believe that technology will play a large role in how we handle this challenge. And I know that that steak looks really funky, I agree, but if it's gonna support our food system, then I think that's a pretty okay compromise. Another technology is biosensing tattoos that's coming to fruition currently. So scientists at MIT and Harvard have been working on a special tattoo ink that contains chemicals that can sense blood sugar levels, pH, and sodium. So when blood sugar goes up, for example, the glucose sensing ink changes from blue to brown, which can be obviously super helpful for diabetic patients. When a person's salt levels increase, the sodium sensing ink becomes a more vibrant green color under UV light. And when alkaline levels shifts, a pH sensor changes from purple to pink. So these are just a few examples of how 21st century health technology. And if you think about how far something like the iPhone has come since its original release in 2007, you can only imagine what kinds of technology we will interact with in our dietetic careers throughout the years. So next, examples of competencies RDs should maintain. And the first 3 are in the sectors of food service management, clinical, and community. And then I threw in a bonus 4th one for you. So the first one is competency using food service management software, such as Computrition. The next one is competency using the EHR system at whatever hospital you'd be working at, such as MedTech. And then I couldn't think of a specific software for a clinical dietitian to do something like inventory, but just being competent using Excel or something else along those lines. And then video conferencing software. So this could be used in like a private practice such as Ladybug Nutrition, or honestly in 2020 and beyond, any field. So in summary, nutrition informatics, which is the intersection of information, nutrition, and technology, impacts all dietitians. Nutrition informatics and health technology improve patient care via telehealth, clinical decision support, EHRs, health information exchange, and computerized provider order entry system, and more. And then proficiency is expected and mastery is desired when it comes to nutrition informatics. If you want to learn more about this topic, here are several sources. The first one is the Academy's homepage that talks about nutrition informatics. They give a quick summary and then some sources to learn more as well. The next one is the Nutrition Informatics Dietetic Practice Group, which is a place for those experienced in nutrition informatics and those wanting to learn more about informatics to share information and resources. The next is the Academy's position paper. After that, we have the Academy's Health Informatics Infrastructure, which we will talk about a little bit more in our live session, but just know that that's also a resource. And then finally, the Nutrition Informatics 360 webinar, which is just an hour long, I believe. And it's pre-recorded, very, very helpful. Definitely taught me a lot about nutrition informatics, which is a topic that I knew next to nothing about before starting this project. So that was definitely really helpful to me. All right, well, that's all I have for you this week. We will see you next week. Thanks. Bye.